evening, you're watching News Epicenter with me, Ridhima Bhatnagar. As COVID cases spread across the globe, specifically China, Japan and the United States, the question here in India is, will we see a wave as well? Now, the government has pressed into action with guidelines and advisories being issued asking people to maintain basic protocols and also asking people to come forward and take their booster dose. In China, infections are still increasing and the death rate, according to epidemiologists, is now worrying. But most experts are optimistic that India may not see a similar wave as our vaccination is much higher and we also have herd immunity. But what about our boosters? What about our unvaccinated children? Going forward, what should be India's strategy?
प्रधानमंत्री जी की सोच स्पष्ट है कि एक स्वस्थ भारत और एक शिक्षित भारत, इसी के आधार पर भारत विश्व पटल पर एक नक्षत्र के रूप में उभरने की पूर्ण क्षमता रखेगा। हेल्थ केयर को हम लोग होलिस्टिक हेल्थ केयर में परिवर्तित करेंगे।
जो भी केंद्र सरकार का दिशा निर्देश है उसका हम पालन करते हुए जीनोम सीक्वेंसिंग करेंगे हर पॉजिटिव।
BF7, which is there in China and is causing a lot of havoc, may not do the same in India because it has actually entered India in October but hasn't spread as much. It's predominantly XBB that we have in our country. So we need not panic, but I think we should also be concerned and take certain precautionary measures.
So let's first begin with the good news, because now India does have a nasal vaccine. So let's break down the details in terms of what all do we know so far. It is India's first needleless intranasal vaccine, which will be available as a booster dose. What we also have a confirmation is, and this is what has been confirmed by the Health Minister, that Bharat Biotech's 2-drop nasal vaccine will soon be introduced on the CoWIN platform. We're also now understanding this can be availed by adults who took Covishield and Covaxin. As far as the pricing is concerned, that of course will be decided soon. The vaccine triggers an immune response in the mucosal membrane and also gives you local immunity in the nose where the virus first enters. But that's the good news. Let's now talk to you about what is our biggest worry. Our biggest worry is that there is a vulnerable section of our population that continues to be at risk. I'm talking about the children, because these are still unvaccinated. Remember, India is home to more than 472 million kids who are under the age of 18. If you look at the seropositivity rate in the age group of 6 to 17, that is comparatively higher than adults. It's at 59.4%. But the problem is they're still unvaccinated. Even though vaccines have been approved for the age group of 5 to 11, the inoculation drive for children is yet to begin, which means under 12. 18.95 crore doses have been administered to the age group of 12 to 18. So will that now be a priority as far as the government is concerned? I want to now begin the show with the CNN News 18 exclusive. We have Professor Peter Hotez, who's a vaccine scientist and virologist, who's joining us here from Texas. Professor Hotez, always a pleasure speaking to you. Thank you so much and taking our time and joining us here on CNN News 18. So let's begin with what's happening globally first. As far as this strain is concerned, what do we know about this strain and how is it different from the previous ones?
Well, we don't have a lot of transparency really on the different virus isolates of COVID-19 coming out of China. We've heard BF7. I don't think we really know what's been happening in most other parts of the world is that you're not seeing a single dominant variant. So in the past, when you had a large new wave, whether it was Alpha or Delta Omicron BA1, BA2, BA5. It was a single dominant variant. What's been happening with these new variants, I sometimes call them scrabble variants because they use high-value scrabble letters like B and X and Q, BQ1, BQ1.1, XBB, now BF7, is that they tend to often occur in different groups. So it may not be a single dominant variant. And that makes it difficult to predict what's going to happen because we haven't seen that situation before. So whether or not BF7 also becomes a dominant variant in India and whether India gets a new surge as a result, it's not as clear-cut to predict as it's been in the past.
So that's exactly the question that a lot of us here in India are now wondering. It's creating a bit of an alarm as well. At this given position, how vulnerable do you think India is?
Well, I think India does have some vulnerability because even though the vaccination rate is high and a significant percentage of the India population has had either a breakthrough infection or a previous infection prior to getting vaccinated, there is some good hybrid immunity across the population. The problem is it may not stand up that well to these new scrabble variants. There'll be some partial protection, but others will be vulnerable. And therefore, I think it's going to be imperative that India really thinks seriously about a booster, preferably a bivalent booster, developed against either BA5 or one of the subsequent scrabble variants. And I think that will ensure that there's no surge in hospitalizations and that sort of thing. And I think that's going to have to be an important priority for India.
So you already spoke about boosters, how that needs to be a priority for India and that rate needs to increase. But what about people like us who've already taken the booster? I mean, it's already been a year for most of us since we took our third dose or the precautionary dose, as it's called in India. Do you still think the efficacy will be high?
There will be some, but it'll be incomplete. And we've seen this in the US. Once you're more than, say, 6 months out of your last booster,
Sure,
there's some vulnerability, not only to infection, but also hospitalization. And that's why here in the US, where we have the bivalent mRNA booster that has both the original lineage that came out of China as well as BA5, I'm strongly recommending all adults and even the teenagers get their bivalent mRNA booster. In India, we have, as you know, our Texas Children's Hospital Center for Vaccine Development has partnered with Biological E for Corbevax, and that's been a very successful program. More than 75 million doses have been administered to adolescents, and maybe another 10 plus million adults have been boosted. Now we're partnering with Biological E for a bivalent version of that. And if that goes well, which includes the BA5, and if that goes well, that may be one of the viable candidates for boosting, although likely not the only one. I'm sure there are others that are coming online. So the bottom line is I do think it could be very important for the Indian population to get boosted with a vaccine that is targeted against BA5 or one of the subsequent scrabble variants. And hopefully some of those options will come online for India fairly soon.
And we in fact do have now very optimistic data coming out of a similar trial where we're also understanding that if you mix and match the boosters, the efficacy actually will be higher. But Professor Hotez, what I essentially also want to understand is what about the symptoms that we're seeing this time around? Is there a reason to worry as far as severity is concerned?
So far, I have not heard any specific reports out of China, and so far, quite honestly, the severity of the variants has not really changed all that much. I think, quite honestly, if you look at the original lineage, Delta or Omicron, there may be some subtle differences, but overall, it's still a very serious infection if you're unvaccinated or undervaccinated. There's a lot of buzz out there that tries to claim Omicron is less serious. I don't really buy it. It's very transmissible, and we've seen a lot of hospitalizations and deaths with Omicron and its subsequent subvariants as well.
So, Professor Hotez, taking on from what you're saying, that you shouldn't take the Omicron variant lightly because it is highly transmissible. Then the worry is, speaking of different countries, this is a pattern that we've seen in the previous waves as well, that they peak at different time. So, if we are to believe the kind of numbers and reports that we're seeing from China, what is your estimate? Will we see a global wave?
Yeah, I think that's probably the most important question. And to be quite honest, I don't have the answer. And the reason is because, as you rightly point out, unlike in the past where you've see a single dominant variant then sweep across the globe, whether it was Alpha or Delta, BA1 Omicron, BA2, BA5 Omicron, now we're not seeing that. So, for instance, we saw a peak of the XBB subvariant in Singapore, whereas in Europe and now in the US, we're starting to see BQ1, BQ1.1. Now you're starting to see BF.7 in China and others. And that makes it hard to really say with any confidence that, yes, you'll see a BF7 surge in India. It could be, or there could be a mixture. And so having these different subvariants in play makes prediction a little bit harder. But I think the most prudent thing to do and the most conservative thing to do is to get a new bivalent booster online in India, just like we've done in the US, and which includes the original lineage and something against BA5 or one of the subvariants. And that's what we've done here in the US with mRNA. And we're now working with Biological E to do this for a new bivalent version of Corbevax, as I'm sure other Indian companies are doing with their version of the vaccine. So I think that's what you might see as the next step. I think one of the big problems is convincing people to take it. So in the U.S., less than 1/3 of the U.S. population is accepting the new bivalent booster. And despite my best efforts to try to convince people to do that, that's been a tough sell here in the United States. And, people just don't want to think about COVID anymore. And so that is a source of frustration, because there will be unnecessary hospitalizations and deaths.
Oh, absolutely. Professor Hotez, it's always a pleasure speaking to you. Thank you so much for joining us here on CNN News 18. Let me also now bring in our other medical experts to really help us understand what should be India's strategy going forward. Should we focus on boosters? Should we focus on a fourth dose? Should we focus on vaccination for children? I have Dr. Nageshwar Reddy. I also have Dr. Giridhar Babu. Good to have both of you on the broadcast with us. A lot of questions that are already coming our way in terms of what people should do in the weeks or months to come. So, Dr. Giridhar Babu, I'd like to begin the conversation with you. Now, reports are suggesting that this particular variant, which is now called BF.7, in fact, has been in India for the past few months. So, isn't that then optimistic, considering the fact that cases haven't gone up?
Yeah, absolutely. It's a good news, mainly because the variant that is as of now circulating in China, from whatever sources we know, although we'll have to wait for the reliable sources and how the genomic variation is occurring in China.
Sure.
The good news is that this is in circulation in India for some time, and therefore it has been circulating at a lower level of infection. Not many people are getting infected. So therefore, there is no cause for concern if this is the variant which will be dominant in China. Now, just to reiterate, all the Omicron variants and its subtypes which are in India, and if the same variants are also responsible for the circulation in China, there is no cause of concern at all for India. The real concern is if there is a new variant, only if that is developing out of the high circulation status in China, and will that infect Indians and other parts of the world? That's the question that we should be concerned about.
Okay, so you're saying if there is an emergence of a new variant, that'll actually be more worrying at this point. But Dr. Babu, what I essentially also want to understand, again, India specific, we had about 4 confirmed cases of this new variant BF.7, and now we're understanding they in fact have recovered pretty well. So now, is there any understanding as far as severity is concerned, or is it still too early because we don't have that kind of a data?
We need to understand, apart from Delta variant that we saw, which was known, at least in India, to have resulted in serious illness. If you look at most of the Omicron and its subvariants, have resulted in mild and mostly asymptomatic illness.
True.
Which means that we might not even know if we don't test it. And that's the kind of infection that's going on with Omicron for a very long time.
Sure.
But this will not be the same in China, for example, because what happens in human beings to their health is a result of not just the virus, but also how the host immunity is and also how the environment is. In China, they have not had natural infection for a very long time after the first wave. The vaccine effectiveness is doubtful.
Okay.
Therefore, the same variant may behave differently, especially among the elderly and those who are immunocompromised. So we should not label this as only a characteristic of virus alone.
Okay.
Yes, it is part of the virus characteristic, but it's also important how the host immune response is.
Okay. Dr. Reddy, I want to bring you also in the conversation. As I said, there are two aspects that people want to understand. One, of course, they want to understand how different this strain is. The other, of course, is a lot of hesitation towards the vaccination and what we could see in days to come. There is good news for India because now there is a nasal vaccine. So I want to understand in terms of data, do we have an understanding how effective nasal vaccines are?
Obviously, the nasal vaccines are effective. That's the reason why the government has approved this. I don't have the actual data with me, but unless it passes a certain degree of appropriateness, the control boards don't pass it. So I think there's been considerable work going on in this area, and the nasal vaccine, which comes from Bharat Biotech, is quite effective. And hopefully it will come into the market very soon.
Okay. Hopefully we will see it in the market very soon. But Dr. Reddy, what I also want to understand is there are two questions: that should we just focus on people who haven't taken the precautionary dose, or should we already start worrying about people who've taken the precautionary dose and may want to now go forward for a fourth dose? Is that a possibility now?
Yeah, there is definitely evidence to suggest that booster doses should be taken because by 6 months, the antibody levels come down.
Yeah.
And after 6 months, better to take another dose. Usually, we place it for a year, and most people, unfortunately, haven't taken even the so-called precautionary booster dose. In fact, 72% of Indian population hasn't taken this booster dose. So I would suggest strongly that you must take these booster doses as quickly as possible because it would potentially prevent any infections coming in now.
But Dr. Babu, do you agree with the point that Dr. Reddy is making, that possibly is it time for India to now talk about a fourth dose as well?
I am not sure whether I completely agree with this statement. Mainly, if you look at the precaution dose or third dose, which in the rest of the world it's termed as, nearly 75% of the adults have not taken it.
True.
And approximately 50% of the elderly have taken it. So if there's any case for a booster dose, it is definitely for elderly and those who are having comorbidities or immunocompromised condition to have the third dose. Regarding fourth dose and beyond, we do not simply have the evidence in India with respect to fourth dose. So I'll probably wait till the evidence emerges. But most importantly, from the evidence available elsewhere, if you are using a different vaccine as a booster compared to what you have used in the primary, our own study in India from CMC Vellore researchers group establishes that you will get a better immune response. And if that precautionary dose can be given in elderly and those who have comorbidities, I think that will be the right thing to do for now.
So I think, Dr. Reddy, this is going to be of interest to you. So what Dr. Babu is saying, that if you do a mix and match as far as a booster is concerned, the efficacy is going to be higher. And you've done enough research here. You're testing a mixed vaccine using Corbevax as a booster for those who have taken Covishield. But this is in stark contrast to what we had heard earlier, that we should continue with the same vaccine. So why are you saying that mixing and matching will be better this time around?
Okay, Ridhima, this is a very important question, and this was a recent article that got published in Vaccine about 3 days back. Now, what we hypothesized was that if we give a mixture of different types of vaccine, then the immune response would be better. This was based on our previous work and work which came from CMC Vellore. We showed that results are better if you mix different types of vaccine. So in this case, what we did was we took actually a group of patients who had Covishield given earlier on, which is a adenovector vaccine, 2 doses. And for the booster, the precautionary dose, we used in one group Covishield. The second group, we used a peptide vaccine, Corbevax, which is again produced in India. So we compared both the groups to see whether you get the same amount of immunogenicity using a different vaccine and same amount of protection. This was after the government of India gave permission to use this as a booster vaccine. Now, what we found surprisingly was that when we actually looked at our patients at 3 months and 9 months, the immune response in terms of antibody levels and T-cell response was much higher with the peptide vaccine compared to the same Covishield that was taken in this patient. So peptide vaccine given as a booster dose gave a much higher immunity level. And also when we followed these patients clinically, a very few of the patients who had taken peptide vaccine actually became symptomatic with the disease, and about 4 or 5 in the other group were symptomatic. So which means that mixing these vaccines, especially giving a peptide vaccine after you give the standard doses, may result in a better immunological response. And also, allergic reactions are much less with peptide vaccines, and that's what we found in our study. So this may be a good idea to actually mix these vaccines rather than do a homologous. So what we're doing is a heterologous vaccination using this booster vaccine.
That was slightly technical for me, Dr. Reddy. So I will request you to break it down further in simpler terms for our viewers as well. Then, of course, the subsequent question is, will mixing actually be effective as far as this BF.7 and its sublineage is concerned?
So against BF7, we don't have data. I think there's no data anywhere in the world against BF7. But what we found is that mixing this vaccine definitely is more effective against Omicron in general. Now, BF17 or XBB are subgroups of Omicron, and we don't have specific data. But if you look at BF7 itself, it's very low in India, very small number of cases have been reported. So it's very difficult to get data on this. But I would think based on the general trend that we saw with Omicron, mixing the vaccines may be a better way to use them in this case.
So, Dr. Reddy, do you then think that vaccines will now become a part of our life? Will they become a part of this routine immunization cycle?
I think, Reema, this is a very important point that you're making. I believe firmly that at least for the next few years, we should take this COVID vaccine routinely as a part of our vaccination schedule every year. In fact, like we take the vaccine for flu, the influenza vaccine, this vaccine also should be given. In fact, there is some thinking whether we should actually use it as a mixed vaccine along with the influenza vaccine. So it should become an yearly vaccine till this disease becomes, of course, extinct, which may take a few years from now.
Well, the hope is that we don't have too many years left with this. But Dr. Babu, I quickly want to go back to a point that I made when I started this show, which is, what about our children? They're currently still unvaccinated. Shouldn't that be a big priority now?
Yeah, so we have been looking at seroprevalence estimates in children, even from whatever unconfirmed sources, and also some published studies we see. The infection in children is also as widely prevalent as in adults. It's not that they're spared from infection.
True.
But this infection has rarely resulted in any serious illness, barring few instances reported in the West, mainly because either they lack the receptor or they don't necessarily have the same kind of clinical consequences which we see in adults. However, in adolescent children, especially between 15 to 18, the call for the vaccination has not been really dealt with seriousness. There is poor coverage there. And since they're also becoming adults, now we are entering from 3rd to 4th year managing COVID. So therefore, we should prioritize as young adults and the cohort of young adults get added into the population. They should be tracked and then they should be vaccinated. But since most of them are infected, their natural infection will give adequate antibody response. So we should not be concerned about children at this stage.
Okay, that's good to hear, Dr. Babu. Dr. Reddy, I'm going to give you the final word. This is the holiday season. People want to travel. There is a sense of optimism that possibly the next year will bring us a lot better. But with the kind of global cases that we are seeing already, do you think India is still in a vulnerable position?
Again, this is a very important point. I believe that we can be very optimistic about what's going to happen in India because our population has already been exposed to both the vaccine, about 80% of the people, and also the previous disease, showing that we already have strong baseline immunity. Plus the factor that our vaccinations done previously are good quality with good response. I think I would believe that the wave that's going to come is going to be very mild. We don't have to panic like what happened last year.
Well, that's good to hear, and that's very optimistic. On that optimistic note, I'll wrap this conversation. Dr. Reddy and Dr. Babu, always a pleasure speaking to both of you. Thank you so much for joining us here on CNN News 18. We have to shift